Great. Well, thanks very much for inviting me to talk today. This is a subject that I have a special interest in because of the impact that it's having on our medical cannabis patients. I've been researching this for about the past 10 years, and there have actually, this is really great timing because there have been some significant actions at the legislative level. So I'm going to go ahead and try and share my screen with you. Share screen. Can you see that okay?
Yes.
Great. So I've entitled my talk Cannabis Legalization in Hawaii based on the information that Greg and I have been exchanging. And I picked this particular symbol because I think it kind of captures what maybe a lot of us are feeling right now. There's this tsunami of recreational legalization heading our way. And I am not an advocate for recreational legalization. I'm an advocate for legitimate medical use under state authorization. And so I'm also looking at ways that we can mitigate and address this tsunami that seems to be gaining support from various commercial sectors. Just a few disclosures. I'm a certifying physician for Hawaii's medical cannabis program, which means that I can certify that patients meet the criteria set by the state, and I can provide information on how to use cannabis safely and effectively. But I am not writing prescriptions. I'm not even recommending to my patients that they use cannabis. I feel that I cannot do this until there is an FDA-approved botanical substance available in our pharmacies. So these are patients who come to me who have decided under their right to decide what happens to their body to select this as an alternative treatment that the state has authorized. I'm not a member or a consultant for any dispensary, and I don't have any other financial interest to disclose. Just a quick background, I do run what's called the Akamai Cannabis Clinic. I've been doing that since 2013. I'm also what's called a certified cannabinoid medicine specialist, meaning that I've been certified by the board of the American Academy of Cannabinoid Medicine as meeting certain criteria above and beyond my primary specialty, which is actually ophthalmology. I was on the 2014 Hawaii Dispensary Task Force, invited by the Department of Health as the physician member. And I also have a background in chemistry at YFARS on the East Coast before medical school, and also worked at the University of Hawaii, Manoa, doing natural products chemistry with the Dr. Scheuer group. I first came across this subject because of a friend with colorectal cancer who used cannabis medically for pain relief, nausea reduction, and appetite stimulation. And that really stimulated my interest in this subject. I had no previous experience in this area. Then I started looking at some of the science, and I was amazed at the amount of research that's already been done on this. And then I started looking at the law. And Governor Cayetano, of course, signed our Medical Use of Cannabis Act into law June 14th, 2000, and went into effect the end of the year. And this is the signature. I actually went to the state archives and did a bit of research on our program and actually how it came to be. It was a fascinating 2-year biennium legislative session and a huge move because we were the first state to adopt the medical use of cannabis through the legislation process. And it is falls under our Uniform Controlled Substances Act, Chapter 329, Part 9, and it is entitled Medical Use of Cannabis. As you'll see, does not say botanical use of cannabis, doesn't say medicinal use. It's medical use, which actually has a very important impact upon the federal regulation of marijuana. And this was the original intent of that bill, to promote Hawaii as being an international center for medical treatment and research, which I think is quite visionary for our state lawmakers at the time. And personally, I feel is the direction that we should be moving. Cannabis itself is a fascinating plant. From a medical and a scientific point of view. It has such stigma attached to it. But these chemicals that the plant is producing, I think have great medical potential, but they have to be developed in the proper way. And so the basis for our state having a medical cannabis program is a constitutional authority reserved to the states to decide how controlled substances are used within the state. You don't see the Department of Justice rushing in and suing our state to shut this program down. That's because it is a constitutional authority. The problem, though, is that when Governor Cayetano signed our Medical Use of Cannabis Act into law, there was a conflict created with the federal Schedule I regulation of marijuana. And at the time, it was the administration felt that if they actually asked the DEA about this, that they would probably just say no. So we're just going to go ahead with it and hope for the best. And maybe figuring if the DEA didn't do anything, that meant that the state had indeed had that authority. But there's this conflict that was created between the federal regulation of marijuana and the state authorized use of cannabis for medical purposes. And this created an attitude, especially among law enforcement, who gain a lot of their narcotics enforcement training from the DEA, that this was just a joke. This was a way for 20-year-old males to gain access to cannabis and do it legally under state law. And this attitude has really hurt our program and our patients. Here is that Schedule I rule that I talked about, 21 CFR 1308.11, which has marijuana, tetrahydrocannabinols, and marijuana extracts listed under the Schedule I rule. The problem, though, is that a federal administrative rule does not preempt a constitutional authority reserved to the states. And so this rule is being unconstitutionally applied to our program, creating this conflict that is actually, I think, promoting this tsunami of recreational legalization. This has huge impact for our patients, finding employment because they're failing drug screening tests that don't test for impairment in the workplace, postal workers, child custody hearings, parents losing custody of their children because their significant others bringing up issues about cannabis use, losing employment because of testing positive on urine drug screening tests, which again does not fulfill the federal drug-free workplace policy. Pilots, you'd be amazed who is being affected by this. Patients who are cannot get life insurance or temporary disability insurance, cannot possess firearms, cannot hunt, which for a lot of families on the Big Island provides for the family. Being evicted from federally subsidized housing, unable to transport between islands, which is especially acute in our state, being an island state. And there's a unique situation on the Big Island for those folks living in Pahala, which is surrounded by federal property. You can't drive either way without crossing federal property, which makes you, puts you at risk for violating federal law. And not being able to do research. We have a state-of-the-art cancer center that could be researching these extracts that patients are making themselves. And I'm seeing some astonishing results in cancer patients who have not responded to any conventional chemotherapy, and they're getting results using extracts that they're making themselves. I'm currently working on a case report that I hope to be able to publish on this. And so what does this all have to do with recreational legalization? Well, by not protecting our state authorized use of cannabis for medical purposes and getting rid of this federal conflict, we are actually attracting criminals to our medical cannabis program. And we have 8 licensees in Hawaii. And, frankly, I don't know who in their right mind would want to have a dispensary license to be considered a continuing criminal enterprise by the IRS, to have to pay a 70% federal income tax because you can't deduct standard business expenses, and to have to pay everything in cash. So I would really like to know who is behind these dispensaries now that the legislature has opened up ownership to outside parties, perhaps mainland multi-state organizations that are operating recreational operations in other states. I think we really need to look at who is behind the dispensaries and see where the motive is for some of their activities. There have been reports of unethical behavior, products that have been produced that are not safe for our patients. But I think what's important to understand is that this whole issue of legalizing the recreational use of marijuana falls squarely with our legislature and our state government. I think you all saw this past session how one of our representatives was very easily able to squash this whole recreational legalization movement in the legislature just by saying that he was not willing to hear any such bills this session. So this is something the legislature has control over. I don't think it's something that we need to be afraid of, because I think the fear just contributes to avoiding a solution for this problem. And we do have a potential solution now. Perhaps you saw HCR 132, which was just passed the final House floor vote last week. And I'll certainly send you information on this. So this has been adopted in final form by the state legislature. It is a resolution, so it is not binding upon the Department of Health. But in my mind, this is very significant. This is the first time that our state legislature, both chambers, has come together and asked the Department of Health to do something about this conflict in the way of a federal exemption to remove this misconception that the state authorized use of cannabis is violating federal law. I see this as really the crux of the problem, and I've been researching this for 10 years. We need to get rid of this conflict. If we wait for the Congress to do something about it, we risk a national cannabis tax that I think will drive people into the black market. We risk losing our state's authority to decide how cannabis will be authorized within the state. That should be something that we preserve so that we can decide whether recreational legalization will ever come here, or if, as I hope, we just focus on medical use and develop that as a real medicine for strictly intrastate use. This resolution is based upon other work that's already been done, specifically in Iowa and Minnesota. But many people are not aware that there's already a federal exemption under the Controlled Substances Act for a state authorized use of peyote by members of the Native American Church. So there is a previous example of this. It's nothing new. There is an administrative procedure in place. Of course, it's yet to be seen how the DEA will respond, but I think our state has a responsibility to do something about a conflict that it created when it authorized the medical use of cannabis for individual use 21 years ago. I think it's really time the state needs to step up, and that's why I'm trying to promote this as a way of not only helping our patients, but also addressing this issue of what is the best way for cannabis to be authorized in Hawaii. I think that's a discussion that really needs to happen with all of the stakeholders, and so that's why I'm very grateful for the opportunity to talk today. Probably not quite what you were expecting from a medical doctor, but I appreciate the opportunity nonetheless. And so what I'm hoping is that HACDACS would consider formally supporting HCR 132. I guess that would mean, adopting a motion and drafting a letter. But if this is something that HACDACS thinks would be an appropriate way to address this issue, I think the Department of Health can use all the encouragement that it can get to do something about this and to move forward. I've written to all of our congressional delegates to try and get support for action on this. So I know that's a lot of information. Happy to provide my presentation in PDF format and welcome any questions.